Hi, my name is Trevor Gagnon. I'm a nursing student at App State and did my report on medication errors, reporting, documenting, and maintaining patient safety. So a brief definition, med errors are any error in the prescribing, dispensing, or administering of any drug or controlled substance to a patient. The med error does not necessarily have to cause harm to the patient to be deemed an error, as long as there is a mistake. And med errors can be prevented, obviously. That is what we're trying to do here. Sources of med errors, you can see them here, inaccurate recording and transcribing orders. You can't read the drug labels. You're not identifying a patient correctly. Verifying errors are wrong. Incomplete delivery of drugs. You're under pressure. Busy shift, etc., etc. Here's some graphics on legal and medication claims from 2005 to 2014. So of all the data collected between those years, med errors accounted for 25% of all legal claims, and then you look over here to how the percentages is broken down. It's crazy at how high some of these are. You can pause the video if you want to read these in detail. I broke up med errors into 3 different parts, so prescribing, dispensing, and administering med errors. So starting with prescribing, it's basically like the incorrect drug selection for a patient. You don't have enough knowledge for the prescribed drug, errors in how much of the drug to give, so decimal point errors, so you think that 0.5 milligrams is 5 milligrams or vice versa for whatever reason. Prescribing a drug that is contraindicating. For example, the patient is allergic to penicillin and the doctor still orders some anyway, and it's your job to catch that and say, hey doc, you can't give this to the patient because they're allergic to it. I have this little doctor's note here, and it's funny because you can't read it, it's chicken scratch, so don't write like that. And then a way to get rid of this is we have electronics technology now, so electronic prescribing. It's great and everything, but sometimes when the hospital is in downtime, you obviously can't use it. And then for physician order entry systems, that's great because it eliminates the need for transcription orders by nursing staff. Okay, so that was it for prescribing. So now on dispensing errors, they usually occur with drugs that have a similar name or appearance, so i.e. Lasix and Losec. They're completely different, but they both start with L. Maybe if you're in a hurry, they both sound sort of the same. When you're here, pulling out of the Pyxis. Other potential errors, so the wrong dose, wrong drug altogether, wrong patient. Remember your 6 med checks. So, right drug, right time, right patient, right route, right dose, and then right documentation as well. And you got to do those 3 times to make sure that you cover all your bases. To reduce dispensing errors, ensure the safe dispensing procedure. So, like I said, the 6 safety checks. Keep the drugs separated when pulling them, and then the use of barcodes and scanning at bedside. So my dad is a packaging engineer at GlaxoSmithKline, and back in 2004, the FDA, there's a slide on it, the FDA released this requirement for human drug products and biologics. It's basically a unit of use barcoding requirements, and then my dad was responsible for GSK to implement this back in 2004. And it was just designed to help reduce the number of medication errors, so that our 6 checks can work. I have a graphic here when I was talking to him, and he explained in really, really great detail, and I'll kind of go through this on how barcodes work, but because it's super interesting. So at every single barcode, and this is the same for all over the world here, so it's a 14-digit number called a GTIN number, or it stands for a Global Trade Item Number. And it's basically just it's a globally unique number for trade items. It's worldwide to help sell products. And then within the number, these bolded numbers here, there's 10 numbers, and that's called the NDC number. And now this is how you identify, for example, Zofran here. One bottle versus a sales pack versus a case. So breaking up this number, so the 0173, this is for the company, so this would be for GSK in this case. The 044, if you notice, they are the same here. Actually, the 0173 is too because it comes from GSK. The 044 stands for Zofran. That is the drug number. That is the same for this all over the place. And then the 002 is how much it is, the specifics. So, for example, 1 or the 024 is the 5, or the 028 is for the the 48 of them in a pack. NDC numbers, they do not change. The only time they do change is if the FDA is issuing like a new drug, or the company is coming out with something else. But this is basically the same, everywhere. So with us working down in Hickory, if people up in Watauga Medical Center wanted to scan Zofran and they for some reason had some from Hickory, it would work because these barcodes are universal, and that is on purpose. So that way, you don't have these med errors and the purpose of scanning, so the computers can read them and everything. But super interesting. And then finally, administration medication errors. So drug is not given to the patient, incorrect administration technique, incorrect dosage, and then you got environmental factors like noise, interruptions, when you're given meds, poor lighting, etc. If the drug is not given to the patient, since the patient has the right to refuse, it is your responsibility to make sure that they have been informed about the possible consequences of their decision in terms that they can understand. For example, like you need to explain the risks and possible consequences of refusing the treatment, like threats of safety, health, and life, the problem, including treatment or diagnosis, or the reason why they're taking the drug, I don't know, the proposed treatment, medication, or diagnosing, testing, any of these. It must be a clear story and easy to read when you explain to them and when you document that you did not give the drug to the patient, so that way, in case you are brought into court, you can protect yourself from this, because the patient refused it, they have the right to, and you explain to them, this is what happens if you refuse it, I'm just letting you know, I can respect your wishes, but this is what we need to do. Reducing admin errors, so check the patient's identity, environmental distractions, get rid of them, checking drug calculations from separate people, you're giving the med at the correct time, etc., etc. And then finally, actions when you taken when you have errors, because it's going to happen to everybody. So obviously, client safety is the #1 priority, and then the nurse should immediately assess and examine the client's condition, notify the physician of the incident as soon as possible, and then if they're stable, or when they're stable, if the error was severe enough, that's when you report up the chain of command. So the nursing supervisor or the nursing manager, whoever's on the floor, and then the nurse, you are responsible for reporting the incident, and you must do it within 24 hours of occurring. This is what a form looks like. It must include the location, the time, an accurate description of what occurred, what was done, etc., and a signature of the nurse involved. And then incident reports are never part of the formal medical record. Obviously, they're not referred to in the record as well. The hospital agency uses IRs for tracking, because the point of these things is just to figure out what went wrong and prevent it from happening in the future. And it's essential risk management to report all med errors, no matter how big or small. So, in conclusion, med errors ranging from high stakes to simple mistakes will happen to everyone eventually. Understanding the importance of reporting these mistakes keeps the patient safe, allows the facility to correct the mistake, and then allows the nurse to learn from his or her mistake and become more proficient. Obviously, there are consequences. Nurses can get everything from disciplinary action to job dismissal, or if it's really bad, civil or criminal charges. But you got to report them, and because it keeps the patient safe and it keeps everyone safe, and you learn from them. So there's my conclusion, my references, and thanks for listening.